Good afternoon and welcome to another edition of Your Health Matters here on Kaieteur Radio. I'm your host Rihanna Ramsey, and today we will be sharing on some information on Polycystic Ovarian Syndrome, or PCOS, a condition that affects women all across the world. And it basically affects their ability to conceive and also causes a number of other health complications. Today, our guest is Dr. Shivani Samlal, a gynecologist and oncologist. And she will be sharing more on the topic. Good afternoon, Dr. Samlal.
Hi, good afternoon, Rihanna.
She's joining us virtually via Zoom all the way from the US. She's on break, but she's taken time to be with us today to tell us more about to share more on the aspect of managing PCOS, because PCOS although it is something that we spread awareness about in September, we still have to continually talk about it because it continues to affect women all across the globe, and it's important to keep it in check so that it doesn't affect other parts of your body, because it has an impact on your whole well-being. And Dr. Samlal, are you hearing me?
Yes, I am.
Yeah, so there was an issue with WhatsApp. I don't know if my operator was able to tell you WhatsApp and Facebook, so we couldn't get to get in contact with you to tell you what was going on. But thank God you're here.
Yes.
So one of the things because we're dealing with PCOS, so we're wrapping up on that. Basically, we're talking about the management of polycystic ovarian syndrome, and there's a notion, or there's a common issue of misdiagnosis. What can doctors do to make sure with precision that what they're dealing with, what a woman, when she comes to get examined, to ensure that they diagnose her directly that, okay, this is PCOS? What can they do?
Basically, is having a sit down with your patient and establish why she is there at your clinic. Establish, based on what she's referring, interview her and basically do a good physical exam on her. There are some notions that basically patients need blood tests to be able to diagnose PCOS, but this is not the case at all. Generally, basically patients would have different signs and symptoms. Some of them, they would even think that is normal for them, and they wouldn't even see it as abnormal. So basically, being able to establish what is the main concern of the patient, and then take it, along from there.
Okay. And when somebody is diagnosed with it, what are some of the, before they're diagnosed, what are some of the early signs or symptoms that they should look for?
So generally, a patient, it all depends on the patient. Generally, some patients it might have one thing earlier than the other. So some of the characteristics or the signs and symptoms are basically, one, abnormal uterine bleeding, which means that abnormal periods for a person. So generally, adolescents, when they hit puberty, one of the first things that happen to them is that they have abnormal periods. So using this alone is not able to make that diagnosis of PCOS. And so you have to be able to know what is normal and what isn't. So a normal period is a period that lasts between 2 to 7 days. So if a period is shorter or longer, that is abnormal. Another characteristic, it has to be between 21 and 35 days. So the interval between one cycle or another. So if that is not, if it's shorter duration or longer, that is also abnormal. And if a patient refers that her period is lighter or heavier than her usual, that is also considered as abnormal, or not seeing their periods. So the abnormal period can vary. So some persons will basically refer not seeing their periods, or skipping periods a few months to not seeing their periods at all, having lighter bleeds, having heavier bleeds. It depends. So that's one thing that most patients would tend to refer early. Some persons might have signs of what you call high androgen level, and this is basically they might have acne, or they might start losing hair. They have hair loss, or they have temporal balding. And some persons might have excess facial hair or excess hair in the back, or between that line between your navel to your pubic area. So those are things that patients would say, oh, but my family has this, or I've always have this. So that's another sign of PCOS. And so sometimes patients don't have this, and when they don't have this, and you're suspecting, you can order in blood test to confirm if they have high levels of testosterone or not. And the other sign that is being used is having an ultrasound finding of PCOS. And this is also very common for adolescents to have this image on an ultrasound. So that's why sometimes it's very, very difficult, and it takes a lot of, high level of suspicion, especially when adolescents present with abnormal bleeding, and then you order an ultrasound and they have this image. So sometimes it is very difficult because this image is very physiological for them on an ultrasound, and that in that initial period. And that is because basically this image is there because your eggs, these follicles, or what these tiny cysts are your follicles, which every woman has a lot of and we're born with. And basically these follicles are responsible for developing, reaching a mature state, and then releasing unhealthy eggs. But because of this abnormal cycle and abnormality that exists in their hormone levels, this doesn't happen. So these follicles remain in an immature state, and they're not able to release eggs, and so women have problem later on in getting pregnant. So patients can can have these things at a very early age. And there's no one thing that can be found or say, okay, this is the first thing that you're going to present with, or it varies from persons to persons. And no two persons are going to present PCOS the same way.
Okay, so no two persons would have the same symptoms or signs or same kind of
exactly
conditionality. In terms of risk factors, can you talk about the risk factors of getting it or being diagnosed with it?
So in terms of risk factors, generally there's basically, let me talk about causes first. There is no specific cause of PCOS. There's lots of studies done, and they're not able to identify, what causes PCOS. But in terms of risk factors, there are some studies that show that, like if your mom or if a sister is affected, that, you are at a risk of developing PCOS also. But sometimes your parents may not know that they have PCOS. So asking the patient, your mom or anybody had problem getting pregnant, or they have facial hair, and then you say, they'll tell you, but this is normal, my mom has facial hair. So you're able to establish that link also. So a family component. And there's some studies that show like patients who've had this rapid weight gain. So patients, for example, during pregnancy, who are, the general tendency is to eat for two, and they put on a lot of weight during pregnancy. And then subsequent to pregnancy, they develop PCOS because of that big increase of weight that they have. And so it doesn't have to happen after pregnancy. It can also happen randomly, because we generally now have a fast food culture and a general tendency of being sedentary. So those are the two main things that are linked as risk factors for PCOS.
we're talking about managing it really, because I'm glad we spoke about it, because we're really refreshing for those who don't know. We're informing them, and those who know, we're refreshing them on what PCS really looks like. But in terms of managing, there are certain lifestyle changes that needs to follow after you're diagnosed with PCOS or polycystic ovarian syndrome. What are some of those changes as a doctor? What would be recommended?
So let me start first and by saying that management will vary. As we said, everyone is different, and no two persons are going to present alike. And so what might be my concern might be not be someone else's concern. But additionally, there are lots of studies out there that show, in terms of patients who are having excess, weight or weight gain, that having lifestyle modifications in terms of, the way they eat and exercise can play a big role in terms of reversing the symptoms of not curing the disease, but reversing the symptoms and the signs of PCOS. So this is one of the biggest components. And there was a study done in 2018 by Teed et al. That shows that this can have a major role, or this has a major role in terms of, helping patients controlling their PCOS. And when they talk about lifestyle changes, I can basically explain patients with PCOS tend to have what you call insulin resistance. And this insulin resistance happens because insulin is a hormone, which happens in patients who are diabetic. They tend to have this insulin resistance. And this hormone is responsible to, when we eat food, to convert that food into energy. So when we need energy, it basically, breaks down that to use that. So these patients are not able to do the normal physiological process as normal, as any person. So they tend to develop high glucose levels and subsequent risk for diabetes. So that's one thing that happens. And so this insulin resistance now happens when patients exercise. They are producing insulin, so they're able to combat that insulin resistance. So that's why exercise plays a huge role in terms of, helping patients with PCOS. And they said basically, moderate physical activity, at least 3 to 5 times a day. And I will tend to tell my patients, don't adopt no hard and fast rule that, you need to exercise 7 days a week or so on, because people get burnout. And then the other thing that happens is once they stop exercising, the weight gain comes back just as easily as when it started. When, the weight that they had, they gain that back really quickly. So it's important to adopt a lifestyle in terms of your exercise, one that you can live with and maintain, not, as soon as you reach a certain weight, you stop exercising. At that point, it becomes more about not maintaining your weight rather than keep losing weight. And they've also talked about the diet, the kind of diet. And this is very challenging for a lot of women. Losing weight, because the PCOS tend to be a very vicious cycle, and there's I looked at the research done by lots of nutritionists. Granted, I am not one, so I'm not really able to help patients a lot in this respect, but they've talked about try to have diets that are low in carbs, because high carb diet tend to basically increase your insulin resistance.
Yes.
They've talked about trying not to skip meals and try to eat healthy, balanced meals. Because when you skip meals, what people tend to do is eat the first thing that they put their hands on, and it might not be the most healthiest of choices. So balanced meals, regular meals tend to and not big meals. It should be, if you can eat 3 meals a day, something between snacks, because when you eat bigger meals, you need more insulin, and you have in higher levels of resistance. So eating smaller portion sizes but balance tends to be better, where you don't have this high upsurge of insulin resistance. So the insulin level, it tends to be, constant and maintained, rather than have these surges. So in terms of food, they've spoken about high fiber diet, low carbs diet, eating regular meals, eating on time, and try not to restrict too much, because this tend to lead to binge eating. And I've heard a lot of persons talked about, I think there was a show where someone talked about having these urges or cravings to eat stuff that they know they're not supposed to eat. So those are things that if the nutritionist and dietitian have recommended. They've also recommended that it's important that you have higher sleep, you have good rest, and do stuff to reduce stress, because those things, stress levels and so forth, they tend to increase cortisol level, and cortisol tend to be related to weight gain. So having also, sleeping well and reducing your stress levels, and you can do many things to reduce your stress levels, such as meditation, yoga, and so forth. Granted, as I said, this is not my areas of expertise, but I try to do some reading so we can orient our viewers.
Yes.
In terms of other management, in terms of PCOS, it's basically, as we said, depending on the symptoms. So I don't want anybody to go self-medicate because that is unhealthy. We've already talked about, what is good for you is not, the best option for someone else. So it depends on your symptoms. If you have abnormal bleeding, you have contraceptive pills that work, or progestin pills that also work to regulate your cycles. Exercise also play a huge role here in regulating your cycles also. In patients who are having, for example, hair loss and so on, they have different medications that can work. Yes. They've spoken about the same contraceptive pills that can make a difference. They spoke about anti-androgen medications like spironolactone that can also help. And there are different other lines of treatment in terms of the hair loss. So patients now with, for example, excessive facial hair can also use different medications, from topical to, hair removal treatment to laser and so forth. And patients who are seeking treatment for infertility, there's also a different line of medication for them. Yes. This can vary from medications to enhance your fertility, to actually, as we said, going back to your diet and exercise that can help you see your periods, ovulate, and even help you get pregnant, to even seeing a fertility specialist to help you get pregnant. And for patients who are having difficult time losing weight, your diet, exercise, seeing a dietitian, nutritionist, or even using medications such as metformin can help you make a difference in terms of losing weight. So there's the line of management really varies and has to be individualized to each and every patient.
So seeing your doctor is very important before you go on any treatment regimen.
Definitely.
Mm-hmm. All right, so we'll take a short break, and when we come back, we'll talk more to Dr. Samuel about managing PCOS.
Getting vaccinated is important in protecting yourself and those around you. The COVID-19 vaccine is not a cure. The Ministry of Health's vaccination drive is to remove the virus's ability to cause hospitalization. It helps to look at your exposure to COVID-19 like this. Best case scenario, you don't get infected, and the worst case scenario is death. Get vaccinated today. This is a message from Guyana's Ministry of Health in collaboration with PAHO WHO.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burbies 99.5 FM. Kaieteur Radio.
Welcome back to Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and we're talking to Dr. Shivani Samuel about managing PCOS. Dr. Samuel, welcome back to the program. We were talking before we went to break about the general management of PCOS, but in terms, just letting our viewers and listeners know why is managing PCOS important? Because we know that you touched on it earlier about it leading to other health complications.
So it is very, very important because it affects women, their their mental, psychological state also. So lots of women have depression and anxiety disorder. There's this tendency, society say also, when women, when a couple aren't getting pregnant, it's obviously the woman's fault most of the time. Yeah. So infertility, and any woman who's, our natural cycle is to get pregnant and bring forth children. So when you're not even able to, have kids, that is also something that, affects us psychologically. And there's this intense burden on women and from society also on women. So there's this big psychological impact of PCOS on a woman's health, and more so mental health. And there's also other long-term repercussions on a woman. And that is because of this, you have to deal with all of this psychological and not psychological, physical changes that your body undergo, this weight gain, this difficulty losing weight, these changes, you're losing your hair, having facial hair, and, these things can really affect a woman at more levels than one. And so women have to deal with that also. And then there's these long-term repercussions such as, high blood pressure, and high cholesterol level, and then the subsequent obesity. And these things, what they do, increase a woman's risk of developing heart diseases. So that's that big problem. And that all of these are linked to cancer. There are studies that in terms of endometrial cancer, which patients with PCOS have the highest risk of developing. And the reason for this is that, during your cycles, you generally produce estrogen and progesterone. And so patients with PCOS, they're mostly subjected to this estrogen levels. And so they don't have that typical protective effect of progesterone on their uterus. And so this puts them at risk of developing the endometrial cancer, which is cancer to the inner lining of your womb. And so we're seeing this as an oncologist, you're seeing this earlier in patients who have PCOS. So normally you diagnose this endometrial cancer, it tends to be a cancer that appears in women mostly after menopause, but you're seeing it earlier in women. And the reason, the most important reason, is because women and PCOS, women are suffering from PCOS. And the other risk factors are like high blood pressure and diabetes. And women with PCOS tend to have these. So they have a lot. They're more at risk of developing endometrial cancer. They're at risk of developing other types of cancer because breast cancer is linked with obesity, and women with PCOS are obese mostly. And there's also the link or the relation to ovarian cancer because of the fact that your ovaries tend to be protected a bit with pregnancy, and women with PCOS tend to suffer from infertility or difficulty getting pregnant. So there's a strong link between PCOS and these different types of cancer, but more so endometrial cancer. So long-term repercussions are there. And so what I see, the general tendency is patients come and they see you, and if they're trying to get pregnant, once they attain their objective, that is it. You don't see them back again once they get pregnant. Or if they come for a symptom, irregular bleeding or whatever condition they get treated, you don't see them back. But it's really important their long-term follow-up because of these these existing long-term health consequences of PCOS.
Okay, so basically you're saying that they should visit their doctor regularly.
Oh, definitely. They need to have regular follow-up. Definitely. But it depends. The frequency will depend on the patient and the condition. Because as we said, we keep saying no two patients are going to be alike. So if a patient is just being diagnosed for the first time and she hasn't had symptoms for a long time, her treatment wouldn't be as aggressive as someone else who have been misdiagnosed or undiagnosed for a long time, and she has complications of her PCOS, or someone who's trying to get pregnant. So basically your frequency of visits and your follow-up will depend on you as a patient and what symptoms you have, how long you've been having PCOS, if you have any complications, what are your objective of treatment. So it all depends, but the most important thing here is a long-term follow-up with your doctor, because PCOS, as we've said, it is chronic. There's no cure. It doesn't go away. There are long-term health complications, so you need to do your regular follow-up. And your risk every year is going to be different. So this year you were seen, you don't have high blood pressure, diabetes, but in 2 years along the line, you have all of these. So it really depends on the patient.
And these risks, these symptoms can get worse if you don't manage it, right?
Definitely. If you don't manage your symptoms, then they definitely will worsen over time, and you develop all the complications that can be reversed if you're managed adequately.
Well, we know one of the leading results of having PCOS, or one of the things that it impacts, is not just the long-term complication, other health complication, but the issue of being able to conceive. We've had persons who went to fertility clinics to get their issues resolved. I know that you're not a fertility clinic expert, but in terms of that, what are some of your recommendations in treating that aspect of it?
Well, it will definitely vary in terms of patients. So a patient basically who is obese, hypertensive, or diabetic, or one of the three, definitely you want to control or manage these conditions before you get pregnant. For me, it doesn't make sense, or you put yourself at risk of losing the pregnancy, or your life at risk going into a pregnancy or trying to get pregnant if you have diabetes, you have PCOS with diabetes uncontrolled, you have high blood pressure that is uncontrolled. So for me, it will start by a patient being able to lose weight and, start making lifestyle modifications, get healthy before she ultimately gets pregnant, because there's so many risks involved. getting pregnant and being unhealthy with PCOS. So starting from that. So that first, and then patients can basically, that can help even patients get pregnant spontaneously, because there are studies that show patients who are able to lose 5 to 10% of their weight in patients who are obese or are overweight, that they can get pregnant spontaneously without any medication, just modifying their lifestyle. And that's one. They also have fertility enhancing medications that can be used also. And so that will depend on, after your assessment with your OBGYN, which line to start with and so forth. There are medications that can help you ovulate and subsequently get pregnant also. And if these don't work, then there are other options where you might need to see a fertility specialist, where you might need to do in vitro fertilization. So I would always use a tiered approach, scale-wise, because sometimes you jump to doing an in vitro fertilization, you spend enormous sums of money, and then it's not successful, or you have a miscarriage subsequently. As we know, the success rates of in vitro varies from person to person also. So I don't have the statistics in terms of the success rates of in vitro in Guyana, but I would say the patients get healthy and do the stepwise approach in terms of trying to get pregnant. And granted too, Rihanna, not everyone can afford an in vitro in Guyana.
True.
It is an expensive procedure, and that's where I think the government can play an important role in terms of helping us establish, fertility clinics that can offer these services to women with PCOS.
In terms of awareness, we know last month was 1 month of awareness, but I'm told that there's not enough, that even for 1 month awareness, given the whole impact of PCOS. A lot of women have it, they don't know they have it. Some of them have it and are basically it's not being managed properly because of the lack of information, or probably they're scared. What do you believe can be done to lift this level of awareness? PCOS.
I think with regards to PCOS, I think granted, I basically was impressed because in clinic you see so many women with PCOS. Sometimes I would literally, I'll be honest, you'll be walking in the streets and you'll see a woman and there's certain check boxes that you will see on her, and you're like, I'm almost sure that she has PCOS. And hundreds of millions of persons have PCOS, and worldwide, and the incidence is 1 to every 10 women, and it's higher in our population in Guyana, in women who are brown skin and so we are at a higher risk of developing PCOS, and many women are undiagnosed or misdiagnosed for years, or and it's because of awareness. And we can do, as you said, so much more. And when I did my first column on PCOS for Chronicle, I was looking at which if we have any organization that is dedicated, and I was really impressed with Sisterhood Support Guyana for patients with PCOS, because that we actually have an organization that is helping women to spread awareness with in terms of PCOS. But to increase this awareness, I think we need to have studies that are done, because without having studies done, persons, Ministry of Health, they wouldn't just put money into awareness and advocacy unless they have stats. I mean, that's how the world works. You need stats, and then
you need to know how many
exactly.
persons are impacted.
Exactly. So that we need to start with that, like doing studies to see how many women are affected by PCOS, and what are the complications of PCOS and how women are really being affected. So having studies will be able to show them that yes, we need to allocate funds to this, that this is a major problem for women in Guyana. And I think that's where we need to start, and doing more sessions such as these that can help spread awareness in terms of PCOS.
So we're basically at the end of our program. We know that you're on your little time off right now, and we're stealing some time from you. But we're just before you go. Just tell us how we can get in contact with you. Persons can get in contact with you if you're on Facebook, or because we know you run a clinic here in Guyana. Some of how they can get more information on PCOS, which is Polycystic Ovarian Syndrome, for those who don't know. Just tell us the general information before you go, so that we can.
For sure, Brianna. So I would start by saying I do have a Facebook page, and if anyone have any concern or so forth, they can contact me there. My information is also there, and maybe at the end of this the session on Facebook, that we can include some information there, like my contact number, or my email, which I'm assuming you have.
Yes, I do.
So you can put that there. I don't mind at all. And they can also reach on Facebook Sisterhood Guyana.
Yes.
So they also
which is an NGO,
offer support to women who have PCOS. So that's another option. And I think Guyana Responsible Parenthood Association tend to spread awareness to regarding PCOS. So that is also another organization that if they need support, also they can seek support and facilities there. So those are the options.
All right. So thank you again, Dr. Samuel. I hear your baby crying, so I know you have to go.
I do have to go. Thanks, Rihanna, for having me.
Thank you for those who listened, who tuned in this week to listen to us. We hope you gathered some information on managing PCOS. Until we hear or see you again, be good to yourself and be safe. Get vaccinated. It's important to protect yourself against COVID-19. We're still in a pandemic, and persons are dying in their numbers. Persons are getting infected. But when you're vaccinated, you double your risk of your protection against being exposed to COVID. So be safe and be good to yourselves until we see you again or hear from you. Bye-bye.
Bye.